Hey guys, my name is Christina Callahan, and the condition today I'm going to be talking about is bursitis. So what is bursitis? It's a painful condition that affects the joints and is caused by inflammation of a bursa. A bursa is a sac-like structure between skin and bone, or between tendons, ligaments, and bone. Humans have approximately 160 bursa, and these bursa are lined by synovial tissues, which produce fluid that lubricates and reduces friction between these structures. It often occurs near joints that perform. For example, the most common places for bursitis are in the shoulder, elbow, hip, and knee. Symptoms and possible complications. So for symptoms, if you have bursitis, the affected joint might feel achy or stiff. It may hurt more when you move it or press on it, and it can appear swollen and red. The only possible complication that I found was that chronic bursitis that is left untreated can result in calcific bursitis, which is a buildup of calcium deposits in the soft tissue. And if this happens, it can result in permanent loss of movement to the area. So causes of bursitis. The most common causes are repetitive motions or positions that put pressure on the bursae around the joint. So some examples. Shoulder bursitis can be caused by throwing a baseball or lifting something over your head repeatedly. Elbow bursitis can be caused by leaning on your elbows for a long period of time. Knee bursitis can be caused by extensive kneeling for tasks such as laying carpet or scrubbing floors. Other causes that don't include repetitive motions or positions that put pressure on the bursa include injury or trauma to the affected area, inflammatory arthritis, gout, infection, etc. So some anatomy. Bursae are flattened sacs that serve as protective buffers between bones and overlapping muscles. We call those deep bursae. It's also between bones and tendons or skin. We call that superficial bursae. And we also have two types, constant and adventitial, and they can both be involved in acute or chronic bursitis. So constant bursae form during embryologic development. They're lined with endothelial cells located between bones and tendons or skin, and they contain synovial cells. These are the cells that secrete a lubricating fluid rich in collagen and proteoglycans. Adventitial bursae form later in life in response to repeated trauma or constant pressure. They lack those endothelial cells, and they also do not contain synovial fluid. All the approximately 160 bursae in the human body, they're all potentially susceptible to injury. However, the picture in this slide shows the most common areas for bursitis, and these are where the major bursae are located in the body. So inflammation at the bursa causes synovial cells to multiply. This increases collagen formation and fluid production. We also have three phases of bursitis: acute, recurrent, and chronic. During the acute phase, local inflammation occurs, and the synovial fluid is thickened, and movement of the joint becomes very painful as a result of this. Chronic bursitis leads to continual pain and can cause weakening of overlying ligaments and tendons, and ultimately rupture those tendons. Because of the possible adverse effects of chronic bursitis on overlying structures, such as the ligaments and tendons, bursitis and tendinitis are often occur together. The differential diagnosis should include both of these diagnoses. So, for different types of bursitis, we separate it into upper extremity bursitis and lower extremity bursitis. So some common types of upper extremity bursitis are subacromial bursitis. It's caused by inflammation of the bursa that separates the superior surface of the supraspinatus tendon. It's often coexistent with supraspinatus tendinitis, or partial or complete thickness tears of the supraspinatus tendon, which is one of the tendons located in the rotator cuff. Subscapular bursitis, caused by inflammation of the bursa found between the subscapularis muscle and the chest wall. The last one is Alcranin bursitis. It is diagnosed by swelling, redness, and pain at the tip of the elbow. It's also one of the most common types of bursitis. Some common causes of this one can be overuse in swimming, skiing, gymnastics, weightlifting, etc. Lower extremity bursitis, we have bursitis of the knee and bursitis of the ankle. The common types of bursitis in the hip are associated with sedentary occupations. They're caused by direct stress on the bursa. They often have, the first one often has a nickname of the Weaver's bottom. Some of them can arise when a defect develops in anterior parts of the hip joint capsule, can be associated with hip pathology as well. For example, rheumatoid arthritis, osteoarthritis, or recreational injury. The greater truncator bursitis is common in overweight and middle-aged women and is associated with acute trauma, overuse, and mechanical factors. Bursitis of the knee, we have the medial collateral ligament bursitis there. Most commonly occurs when injury due to a twisting injury or external tibial rotation occurs. Pes bursitis is not usually associated with overuse, but may occur in patients with medial compartmental osteoarthritis. Clinically, these patients complain of pain over the inside of the knee. Prepatellar bursitis is also known as housemaid's knee. It's associated with trauma or repetitive kneeling over an extended period. The last one is popliteal bursitis, and it's associated with local swelling and pain when walking, jumping, or squatting. And then lastly, we have bursitis of the ankle, most commonly retrocalcaneal bursitis, and it's generally caused by trauma from poorly designed shoes. So for diagnosis, doctors will usually diagnose bursitis based on symptoms and findings during a physical exam. However, other diagnostic tests are usually used to rule out other causes of pain. So they use an x-ray often to look at the affected area to look for bony spurs or arthritis. Aspiration, fluid is taken from the swollen bursa and evaluated under a microscope to rule out gout or infection. Blood tests are used to screen for conditions such as rheumatoid arthritis or diabetes. And MRI tests, they can be done very rare. So for prevention, while not all types of bursitis can be prevented, risk and severity of flare-ups can be reduced by using kneeling pads. If you use padding, if you have a job or a hobby that requires a lot of kneeling. Lifting properly, for example, bend your knees when you lift. Failing to do so puts extra stress on the bursae and your hips. Wheeling heavy loads. If you carry heavy loads, it puts stress on bursae and your shoulders. Taking frequent breaks. Alternate repetitive tasks with rest or other activities. Maintaining a healthy weight. Being overweight places more stress on your joints in general. Exercising, strengthening your muscles so you can help protect your affected joints. And then lastly, warming up and stretching before strenuous activities to protect your joints from injury. So treatments and medications. Initial treatments consist of over-the-counter non-steroidal anti-inflammatory drugs such as Aleve or Advil to reduce pain and inflammation. Cold and heat treatments, ice and heat packs, things like that. Corticosteroids, also known as cortisone shots. They may be injected into and around the inflamed bursae. In severe cases, fluid may even need to be withdrawn from the inflamed and swollen bursae. And in persistent conditions, these bursae can actually be surgically removed, which is like the worst case scenario. Lastly, we also have physical therapy programs, and that includes stretching and focusing on strengthening exercises. A physical therapist may also apply heat and stim, electrical stimulation or like ultrasounds or anything like that to relax the joint. In history, bursitis accounts for more than 0.4% of all visits to primary care clinics. Incidence of bursitis is higher in athletes, reaching levels as high as 10% in runners. Mortality in patients with bursitis is extremely low. The prognosis is very good, with majority of patients being able to receive outpatient follow-ups and treatments. So in conclusion, even though bursitis is a painful condition that affects the joints caused by inflammation of the bursae, diagnosis is very simple when going to the doctor and things like that. And there's also a wide variety of preventatives and treatments to prevent bursitis or prevent the flare-ups for someone that has had it. All right, guys, thank you for watching.